Hello, ladies and gentlemen. Welcome to Brain Boosters platform. Today, in this presentation, I'll be discussing anxiety and I'll be answering a particular question. I'll be focusing on nursing care of an anxious client. So, this is the question that I have here. It's about anxiety, and I'm concentrating on part C, which says outline the nursing management of an anxious patient in a psychiatric facility. Outline the nursing management of an anxious patient in a psychiatric facility. Okay, so the question is straightforward. This patient is admitted in a psychiatric facility or ward. Now we are being requested to provide the nursing care only. So how do we answer this question? So I'll begin with M's. I prefer starting with M's, of course, and you have to also begin with M's. And I'm sure we know how to state our M's by now. So I have these 4 M's, but a minimum of 3 M's is okay. Prevention, or to prevent complications, also to allay anxiety, to maintain safety, and to promote rest. These are some of the aims for my management, for my nursing care. Okay, so your aims will depend on what you'll be doing exactly in your nursing care, and you don't have to write aims about every intervention. It's not necessary. You only have 2 marks, 2% to work for under aims. The next part is the environment. What kind of environment am I going to nurse this patient from? So the environment should be less stimulating, dim lighting and well ventilated, well damp dusted and secure. Okay, so I'm sure we know how to write our interventions by now. There must be you have to personalize these statements. Begin with I will, okay, and give a rationale for each intervention. So I will nurse the patient in a less stimulating environment to prevent escalation of anxiety or exacerbation of anxiety or simply worsening of anxiety. Okay, then I will nurse the patient in an environment with dim lighting, also to prevent triggering anxiety or worsening of anxiety. In a well ventilated environment to promote comfort also and prevent nosocomial infections. Okay, also well damp dusted environment. I will nurse the patient in a well damp dusted environment also to prevent the patient from acquiring infections and also to promote comfort. Secure environment. I will nurse the patient in a secure environment also to prevent the client from escaping or from absconding from the ward. The next point I would like to talk about is building trust or simply establishing a therapeutic relationship. So what exactly am I supposed to be doing? I'll introduce myself to the patient so that he knows who he is working with, and that he should be able to comply and be willing to work with me. Okay, so speak calmly and answer client's questions. So I will speak calmly and answer client's questions to allay anxiety as well. Okay, so I shouldn't be threatening to the client. I should be able to speak in a soft voice, in a soft manner, not being too aggressive and judgmental. Okay, do not be judgmental about the client's condition or about the client, because once the client sees that you are being judgmental, he may withhold a lot of important information that you may need in your nursing care or in managing this client's condition. So make sure you don't appear judgmental. Okay, You need to offer genuine respect to the client. Do not call the client by his condition. This client has a name, so you need to address him by his name. Avoid touching the patient without permission. Okay, so I will avoid touching the patient without permission to prevent unwanted reactions or violent reactions from the client. Remember, the patient may misinterpret your actions, or he may just have those natural reflexes of self-defense. And if you are touching him without letting him know what you're about to do, he may try to defend himself, okay, and will appear like he's attacking you. Explain your procedures to the client to allay anxiety. It's very, very important that I explain the procedures that I'm carrying out on the client, so that I do not unnecessarily trigger anxiety in the patient, because he has no information, or he does not know what I'm doing. Okay, the client may be very suspicious, so I need to be careful each time I'm attending to him. Maintaining safety is also a priority. I have to make sure that if the client is in panic state, I remove any items that may injure him. Any items from the environment that may be dangerous, they have to be removed. Okay, this is to prevent physical injuries, of course. Avoid being too close to a confused client to prevent any physical attacks from the client. So being too close to the client may or to an agitated client is not advisable, because the client may vent on you by hitting on you. So you need to make sure that you are at least 2 arms length away from the client to prevent such physical attacks. Avoid situations that may exacerbate client's anxiety. It's very important that any situation that may increase the client's anxiety is avoided. Okay, so this will at least prevent exacerbation of anxiety, yes, and also triggering of anxiety, and any bad reactions that may arise as a result of the anxiety that the client has. Offering support is another necessary item that we need to attend to. We need to offer support to the client. Okay, this could be physical, emotional, financial, any support that is necessary that you can offer. So do not leave the patient alone, especially when the client has severe and panic anxiety. Don't leave them alone. Being available for the client, you will be actually offering physical, social, and emotional support to the client as you chat with him. Allow relative or person of choice to be around whenever patient needs them. So it's important that you also involve family members or any person of interest to be with the client. Familiar faces usually help to allay anxiety. Okay, familiar faces in the environment will create a familiar environment, and the patient may not have unnecessary anxiety. Okay, so make sure that you invite family members to come through and friends to be with the patient, to visit the patient, so that he will feel at home and loved. Because sometimes just being in a new environment is also another trigger for anxiety. So we need to try by all means to create a friendly environment with familiar faces. Listen and pay attention to the needs of the client and be available to help. So the client may be talking a lot, venting, he's trying to vent, he's trying to offload his frustration and all that. We have to pay attention. Talk less and listen more. By doing this, you are simply providing emotional support to the client. Okay, there are a lot of points also that you can talk about in here. You should feel free to bring them up. Okay, feel free to bring them up at this point. Another one is assisting client learning ways of interrupting obsessive thoughts by thought stopping. The client must be assisted, especially if they are having obsessive thoughts. You can assist them to learn new ways of interrupting those obsessive thoughts. Okay? For medicines, ladies and gentlemen, we need to administer anxiolytics and any other tranquilizing drugs that have been prescribed at the right dose, the right patient, the right time, the right amount, of course. Okay, yeah, that's the dose. Okay, so make sure that you administer such drugs to help reduce anxiety levels or handle certain symptoms that are really frustrating or affecting the client so much. Okay, so administration of these drugs will help you to control the client's anxiety. Also, assess medication for effectiveness and for adverse side effects. It's very important also that we assess the effectiveness of the drugs that the client is taking. If it's not effective, you may decide to change the drug or you simply make alterations with the dosage. Maybe the client needs a higher dose. And if there are any adverse side effects, you may also be required to change the drug. Okay, yeah, so that's about medication. The other intervention is about cognitive behavioral therapy. What you need to know is that this type of therapy has got two components. We have the cognitive therapy and behavioral therapy. These can be written separately if you like. Why this is written as one word, cognitive behavioral therapy, is because the behaviors of a person are usually determined by how they perceive the environment around them. Okay, it's believed that how the person perceives the environment around him or her will determine or affect his behavior or responses in that environment. Okay, so we usually want to avoid a patient having negative thoughts. Okay, we don't want this client to have maladaptive behaviors that are disturbing, that are not accepted in the environment. So assist client to replace negative thoughts and feelings with ones that are more realistic. Alright, so client may be misinterpreting the environment around him, may have wrong perceptions of what's happening, and he will end up behaving in a manner that we don't want him to behave, in a negative way. So it's important that you assist the client to replace those negative thoughts and feelings with ones that make sense, with ones that are realistic, with ones that are real. Also encourage client to ask himself whether his view of a situation is based on fact or an inaccurate perception of what's going on. This will help reshape negative or inaccurate thinking. It's very important also that you encourage the client to be asking himself before he reacts. He needs to try and ask himself if he has really gotten the true information about whatever he is thinking of. Okay, or has the patient confirmed the situation, the happenings, before he perceives something wrong. Okay, this will help the patient avoid acting on perceptions. Okay, he will always wait for the truth to come out, or he will always try to find out the truth before he reacts. Okay, so we know the definition of anxiety is that it's simply fear that comes as a result of perceiving danger. You are perceiving danger and you develop that fear, or you react in a manner that disturbs your function. Okay, avoid having this anxiety. The client should not be working on perceptions, but must always prove his perceptions. So encourage the client to talk about the feelings and to describe them in as much detail as the client can tolerate. So it's also vital that you encourage the client to talk about how he feels, okay, what he thinks, and describe exactly how he feels. This will help you as a healthcare provider to understand the client situation better. Assist client to use exposure and response prevention behavioral techniques. Right. So if the client is especially suffering from phobia type of anxiety, the client can be exposed to such kind of therapies where the client is exposed to whatever feared situation, and then um, uh, he will respond, of course, in a manner that you teach him to respond, or to behave or to respond in a manner that you expect him to respond, okay, in an acceptable way. So this exposure and response prevention behavioral techniques will help the client to develop good ways of responding to a feared situation, okay, or acceptable ways of behaving or reacting to whatever situation they are scared of. Encourage clients to talk about traumatic experiences and help him walk through feelings of guilt related to the traumatic event, okay. So yes, we have to also help the patient to talk. As the client talks, they'll be venting out their frustrations. Okay, so talking really helps the patient to relax and to vent out their frustrations and fears. And also, while the client is explaining this to you, you should also suggest a better way of helping him out so that he can get out of such a situation. Okay, so that he can walk through these feelings of guilty that are related to whatever traumatic experience that they went through. Also, assist client in identifying new methods of coping with disabling anxiety. Okay, so there are a lot of ways that you can suggest to the client depending on your assessment and the needs of the patient. You determine which method is better for this client to use as a coping strategy. Okay, so this will help the client to grow and also learn new ways of how to resolve their situation. Acknowledge the patient's feelings to help the patient feel he is being heard. Okay, so you need to acknowledge how the client feels. Do not be judgmental about the client's feelings. Okay, identify any maladaptive responses and encourage the client to adopt more positive responses. This one is very important, ladies and gentlemen. Okay, we don't want a client to be responding in a manner that is preventing him from working, from being productive at work. The other point that I would like to talk about is psychological care. This one is important as well. It's a form of counseling or talk therapy that you involve the client in. Okay, so use simple words and brief messages, speak calmly and clearly, and allow the client to ask questions. It's very important because the client has anxiety, and it's anxiety that we are treating here. So to allay this anxiety, you need to allow the client to ask you questions and speak in a manner that the client will be able to understand you. The client will have no time to be asking you to repeat what you said. You have to be straightforward yourself. You need to speak a language. Don't use jargons. Use a language or words that are easily understood. Okay. If the client does not understand what you're saying, you'll be confusing him more and exacerbating his anxiety. Offer psychoeducation to increase awareness and build insight. Okay, so you need to offer education to the client about his condition and about whatever is triggering his anxiety, so that the client has a knowledge about that situation. And once the client has this knowledge, you increase his insight, and then anxiety will be managed well. Okay, answer clients' questions accordingly. You need to answer clients' questions accordingly. Do not leave clients with unanswered questions, because that will also exacerbate his anxiety. Explain every procedure to allay anxiety. Very important. I think I talked about this already as well. Keep talking to the patient in a comforting manner, even though the client cannot process what the nurse is saying, cannot process what you as a nurse is saying. So you have to make sure that you keep talking to the client to distract him also from his destructive thoughts, from his disturbing thoughts. Okay, so you keep talking to the client, asking him questions and all that, because you want to distract him from his disturbing thoughts that are triggering his anxiety. Reassure the person that this anxiety, that it will pass, and that he or she is in the safe place. So once the client knows that they are indeed protected, they are safe, they will not be afraid of anything. At least you will have managed their anxiety in this case. There is a lot of information, ladies and gentlemen, you can talk about under psychotherapy or psychological care. You need to do your own research for additional information on this one. Okay, relaxation techniques. Also, I need to demonstrate and practice the techniques with a client, such as deep breathing, imagery, music therapy. This will promote relaxation for the patient and the release of endorphins that will further reduce anxiety. So yeah, this is also important. Relaxation techniques, we need to teach the client how to relax. These are also referred to as coping skills, coping strategies. By so doing, whenever the client has an attack, they'll be adopting these relaxation techniques. They'll be using these relaxation techniques to reduce their levels of anxiety. Okay, whenever we are managing a patient with anxiety, our aim is to take them to at least mild states where they can easily be managed, because we have 4 stages of anxiety, 4 of them. I want you to take a look at my previous presentation. I think I talked about these already. So this intervention should take place when the client's anxiety is low, so he or she can learn more effectively. Okay, so what I'm doing here is that teaching the client these relaxation techniques will only take place once I notice the client is stable and can actually learn and get instructions from me. Okay, that's when I will initiate this kind of relaxation techniques. Recognize precipitating factors. Explore with client possible reasons for occurrence. This will help the client be able to interrupt escalation of anxiety. Okay, so it's important to find out what are the triggering factors of this client's anxiety. Once you find these triggering factors, you may easily put in preventive measures, okay, and be able to interrupt worsening of anxiety or triggering of anxiety in this client. Encourage healthy, pleasurable activities and exercise, and to resume activities that have been helpful in the past. It's very important that the client is involved in other pleasurable activities and also some exercises, and also the client should be able to recall and resume whatever activities he's been using in the past and they've been helpful. He can still reuse them even now. Okay, so you need to encourage the client to find what methods he's been using to cope with his anxiety in the past, okay, and bring them into use this time around. Structured scheduled activities, provide diversion of therapy, encourage physical exercises. I talked about physical exercise already. This diversion of therapy could be anything. Of course, physical exercise is an example. Listening to music, um, going to watch football, going to socialize with friends. All these are diversional therapies that you can provide or encourage the client to adopt. The other part of the nursing care we can talk about is coping strategies. Okay, coping strategies. I've talked about some already, but encourage avoidance behaviors of situations that trigger anxiety, such as being away from social gatherings, etc. This will help prevent anxiety, okay, or exacerbate uh, patient's anxiety. So we need to encourage the clients to adopt this type of behavior, which is avoidance behavior, where they will avoid situations or factors that trigger their anxiety. So this can only be done when the client has understood or discovered what exactly exacerbates or triggers his anxiety. Encourage distraction behaviors such as spending time with loved ones and playing games. So these behaviors will help distract the client or deviate the client's mind from focusing on his disturbing thoughts to at least playing and interacting with friends. Okay, encourage checking behaviors by directing one's attention to a physical object in an attempt to be reassured. Encouraging checking behaviors, especially in clients suffering from OCD. These checking behaviors will make the patient confirm that what they are scared of is not real. It's not happening. Okay, what they are being scared of is actually just a perception. They are just imagining. It's not real. So these checking behaviors will help the client confirm their fears. Will help the client confirm whatever they are scared of. For example, if the client is scared that he or she might be attacked in her own house during the night, the client may adopt a checking behavior where he'll be waking up at night to check again whether she really locked the windows and the doors to the house. Okay, after checking, his anxiety will lower, at least he is going to become better. Okay, because he has confirmed that he is actually safe. All right. Okay, but this type of therapy usually works better in clients suffering from OCD, obsessive compulsive disorders, and post-traumatic disorders. And also this shouldn't be prolonged, okay, because checking behaviors may be very disturbing also. So there must be a time frame at which the client can be checking whether the doors and windows are locked and all that. If this checking becomes disturbing also, where the client develops insomnia because he's waking up every after 2 hours or every after 30 minutes to check again and confirm if the doors are still locked, that will that is another condition that we need to attend to. So the patient needs to schedule checking behaviors. Okay, at least every after 3 hours or 4 hours, he will have rested by then. Coping strategies still, and also another point is encourage the client to practice these techniques until he or she is comfortable doing them. When the client has mastered relaxation techniques, he or she can begin to use them when anxiety increases. Okay, so these coping strategies or relaxation techniques, once the client understands them, internalizes them, he'll be able to use them whenever he has an attack, even at home. In addition to decreasing anxiety, the client gains an increased sense of control that can lead to improved self-esteem. So another point that I would like to talk about is nutrition. Promote and encourage a healthy, balanced diet and hydration therapy. Okay, so anxiety can actually be managed by having a healthy diet and also a healthy and balanced diet, and also with good hydration of the body. Okay, so this intervention will simply help to also allay anxiety. Limit caffeine containing foods, alcohol and carbonated beverages, because these have a potential of exacerbating anxiety. So you need to limit the intake of these and tell the client to actually stop taking these type of foods, okay, or beverages. Encourage family members to bring clients' favorite food to maintain a balanced nutritional status. Very important that the client is involved, because the client may make demands of certain foods that as a hospital you may not be able to provide. So encourage family members to be fully involved, to bring the client's favorite foods and meals, so that we prevent malnourishment and promote and maintain a good nutritional status. Promoting good sleeping patterns. Client with anxiety may have insomnia. So we have to promote good sleeping patterns in the client. Make sure the room is noise free. Okay, so provide a conducive environment which is noise free and with dim lighting, and that will promote rest and sleep. If client can't sleep after all interventions, administer sedatives, okay, because these will help the client relax and he will end up sleeping. Group therapy is important, and this one is very important after the client has stabilized. So when the client is stable, involve them into group therapies. Now, these are some of the roles or the interventions that you can write under group therapy. Attach the client to a group therapy session. Okay, so some group therapy sessions are outside the ward, and you will need to attach the client or refer the client to such group therapies, so that he may also go and learn more about his condition. Remind the client to go for his group therapy session so he does not miss an important session. So after you attach this client to these group therapy sessions, group therapies, you need to be reminding him, especially if he's still in your ward, you need to be reminding him to go for these group therapies, or you escort him actually to go for these group therapies, okay, so that he does not forget or skip a session. Request for feedback from a client, so you assess if the sessions are productive. So it's important that you also request for clients' feedback, especially when they come back from these group therapy sessions, so that you can just see whether the client is learning something or not. Family therapy, ladies and gentlemen, is focusing on the following interventions. Educate family about the patient's condition. They really have to know anxiety and how it comes about. They have to understand what type of disorder it is. Encourage family to be involved in the care of the patient. So the family should be involved in the care of the patient. So they need to be communicated to and fully involved in the care of the patient. This will help empower them with skills they will need to handle the client after discharge at home. Help family know how they can be of help to the patient. So you need to teach them what role they'll be playing, what roles will they be playing in this client's life, okay, so that they do not neglect the client. Thank you guys, thank you ladies and gentlemen for watching. If you are viewing my videos for the first time, please remember to subscribe and to my channel. That's the only way you can support me. For now, thank you for watching. Bye bye.